Hello, it's Jennifer Shepard, your Integrative Manual Physical Therapist, and this summer I turned 50. And I'm excited about it because I've done lots of growing and changing, especially in these past 5 to 10 years, as far as who I want to be and where I want to go and how I want to serve and love my family and love my people. So it's been beautiful growth, and I'm excited for these next couple, maybe few decades for me. However, at the same time, turning 50, there are still significant changes that are happening in my body. We cannot stop aging. We cannot stop the clock. There's lots of people out there who want to live till they're 100. I really don't. I just want to live as healthy as I can, as long as I can. And I don't want the end of my life to be unhealthy, and as the case is for my parents and many other our parents. So I'm not interested in living until I'm 100. I just want to live as well and healthy as I can for the rest of my life. So, but our bodies still change. Our cells are changing. Our hormones are changing. And I've been a little frustrated probably the past month, because I'm starting to feel the changes. I'm feeling it in my hair as my hair thins just a little bit. My skin starts to sag a little bit more. My metabolism is slowing down even more. What's bothering me the most, though, is soft tissue injuries and some joint issues. And as you know, I take really, really good care of my body. I mobilize, I stabilize on a regular basis. I'm watching my position and posture. I'm strengthening as I need to, trying to keep myself out of trouble and not get injured. Sometimes that still happens even to the best of us. I'm low inflammatory. I know the foods that irritate my GI. My GI is in such a healthier place. And I'm even on hormone replacement therapy, which has been a life changer, game changer, mostly for my brain health and energy. So I'm a little frustrated because I'm doing all the things. So I think my lesson for myself and for all of you is, number one, being gentle and patient with yourselves, and and I think maybe it's more so, what do we need to change? So sure, I'm doing all the things, but maybe I still need to change something up. I've started to explore with regard to metabolism, the concept of fasting. I've struggled with fasting, and my body has not done well with fasting. I've done the Prolon, which I love the feeling of being in ketosis. I love that feeling, that mental clarity. I love how my skin and my fat tissue, I hold a lot of fat, especially on my thighs and my upper arms. I love how my body feels when I get into that state. But towards the end of those fasting diets, I really struggled. My liver struggled to detoxify. So as I did that a couple times, just because I was curious and wanted to explore, I think I realized, hey, I still need to do more work in detoxification. And as I dive back into my old genetics, yep, I've got some of those single nucleotide polymorphisms, those SNPs, those genetic aberrations that make me a bit more vulnerable and make it more challenging for me to do detoxification. So I've jumped back in, more time in the sauna, more time with dry brushing. I brought the castor oil pack on, realizing that this is an important piece that maybe I've let slack a little bit. Another thing I'm starting to explore along those lines, I did buy the glucose ketone meter just to see, how does my body do with regard to glucose? And again, another part of my genetics, I've got a slow metabolism, and I easily create fat and fat cells. So knowing that, these are the cards I've been dealt with, how do I work with that? So again, I think I eat really, really well. I eat really, really clean for the most part. But as I started to look at those metrics and those numbers, my body struggles to break down the glucose. So I really am borderline insulin resistant. And that's when the insulin can't break down the sugar in your body. And the more sugar in your body floating around, the more inflammation is created in your body. So that really was an eye-opener for me, as far as, wow, it doesn't take much for my blood sugar to go up, and it takes a while for my blood sugar to come down. So I'm really experimenting with cycling through different fastings, ketosis. Mindy Pelz's book, Fast Like a Girl, has been really helpful for me, and it's taken me a while to slowly learn and embrace and implement. And so much of what we do is trial and error. Your body is unique. My body is unique. But if something's not working, step back and evaluate. What's everything that I'm doing? Is there something that I need to look a little bit closer at? Are there any holes in what I'm doing, or something sneaking in that shouldn't be. And it is hard to do it on your own. I'm blessed that I have my background in functional medicine and integrative manual therapy, and I've worked with some of the greatest functional med professionals and manual therapists in the world to help guide me on my journey as well. But it really does take somebody with that knowledge of a whole person, being able to look at you, your entire history, look at you from head to toe, understand all of your systems and how symptoms relate to systems, and then guide you in the right direction. And for most things, it's not an overnight fix. It's what do you need to tweak? And what are we going to measure to see if what you're doing is moving the needle? So I love helping people problem solve what they're doing, problem solve where they need to support their bodies. Everyone is unique. Listen to your body and find your integrated manual physical therapist.